Hey future nurses! If fluid and electrolytes always trip you up, don't worry. Today's video is packed with 50 must-know Nclex questions, answers, and easy strategies that will finally make everything click. From sodium shifts to potassium killers, I'll break it down in a way you can't get wrong. Stick with me until the end, because the last few questions are the exact type that repeat on the Nclex every year, and they could be the difference between passing and failing. Let's dive right in. Question 1. A patient receiving 4-furosemide is at risk for which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypomagnesemia. Answer: B. Hypokalemia. Rationale: furosemide is a loop diuretic that increases urinary excretion of sodium, chloride, and potassium. The excessive loss of potassium places the patient at risk for hypokalemia, which can cause arrhythmias and muscle weakness. Strategy: always monitor potassium with loop diuretics. Think. Loop equals lose K+. Question 2. Which electrolyte imbalance is associated with peaked T waves on ECG? A. Hypokalemia. B. Hyperkalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hyperkalemia. Rationale: elevated potassium levels alter cardiac conduction, producing tall, peaked T waves on ECG. If untreated, it may progress to ventricular fibrillation or asystole. Strategy: potassium directly affects the heart. High K equals peaked T, low K equals flat T. Question 3. Prolonged vomiting leads to A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Answer: C. Metabolic alkalosis. Rationale: vomiting causes loss of hydrochloric acid, HCl, from the stomach. The body loses acid, so pH rises, leading to metabolic alkalosis. Strategy: vomiting equals alkalosis. Diarrhea equals acidosis. Easy Nclex trick. Question 4, SATA. Which findings suggest hypocalcemia? A. Positive Chvostek's sign. B. Tingling around the mouth. C. Constipation. D. Trousseau's sign. E. Decreased reflexes. Answer: A, B, D. Rationale: hypocalcemia increases neuromuscular excitability. Chvostek's sign, facial twitch with tapping, Trousseau's sign, spasm with BP cuff, and perioral tingling are classic indicators. Constipation and decreased reflexes are seen in hypercalcemia. Strategy: Trousseau plus Chvostek equals low Ca. Question 5. Which 4 fluid is used for fluid resuscitation in dehydration? A. 0.9% NS. B. 0.45% NS. C. D5W. D. 3% NS. Answer: A. 0.9% NS. Rationale: isotonic fluids, like normal saline, restore intravascular volume without shifting water into or out of cells, making them first line for dehydration. Strategy: isotonic equals resuscitation. Use hypotonic for intracellular dehydration, hypertonic for critical hyponatremia/ICP. Question 6. Which patient is most at risk for hypernatremia? A. Patient with SIAD. B. Patient with diabetes insipidus. C. Patient on thiazide diuretics. D. Patient with Addison's disease. Answer: B. Patient with diabetes insipidus. Rationale: diabetes insipidus causes massive water loss, polyuria, due to low ADH. This concentrates sodium in the blood, leading to hypernatremia. Strategy: too much water equals low Na, SIAD. Too little water equals high Na, DI. Question 7, priority order. Arrange interventions for potassium 6.9 milliequivalent/L with ECG changes. Administer insulin with glucose. Give 4 calcium gluconate. Administer sodium polystyrene sulfonate. Prepare for dialysis. Answer, 2134. Rationale, calcium gluconate stabilizes the myocardium first. Insulin with glucose shifts potassium into cells. K-Exolate removes potassium through stool. Dialysis is last if refractory. Strategy, hyperkalemia equals protect shift remove. Question 8. Which symptom is most concerning in hyponatremia? A. Nausea. B. Thirst. C. Confusion. D. Fatigue. Answer, C. Confusion. Rationale, sodium controls water movement in the brain. Severe hyponatremia causes cerebral edema, leading to confusion, seizures, coma. Strategy, sodium imbalance equals neuro changes first. Question 9, SADA. Signs of dehydration include A. Dry mucous membranes. B. Weight gain. C. Tachycardia. D. Hypotension. E. Crackles in lungs. Answer, A, C, D. Rationale, dehydration reduces circulating volume. The body compensates with tachycardia, but BP drops. Mucous membranes dry out. Weight gain and crackles indicate fluid overload, not deficit. Strategy, think low volume equals dry plus fast plus low BP. Question 10. Alcoholism most often causes A. Hypercalcemia. B. Hypernatremia. C. Hypomagnesemia. D. Hypokalemia. Answer, C. Hypomagnesemia. Rationale, chronic alcohol use leads to poor nutrition and increased magnesium excretion. Low magnesium causes tremors, seizures, and arrhythmias. Strategy, alcohol equals low Mg plus low thiamine. Question 11. Which electrolyte imbalance increases digoxin toxicity? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Answer, B. Hypokalemia. Rationale, low potassium increases sensitivity of cardiac cells to digoxin, raising risk for dangerous arrhythmias, even when digoxin levels are normal. Strategy, always check potassium before giving digoxin. Low K plus digoxin equals deadly rhythm. Question 12. Which ABG shows metabolic acidosis? A. pH 7.51, HCO329, PaCO238. B. pH 7.29, HCO318, PaCO240. C. pH 7.47, HCO322, PaCO230. D. pH 7.31, HCO326, PaCO250. Answer, B. pH 7.29, HCO318, PaCO240. Rationale, acidosis equals pH less than 7.35. Here, HCO3 is low metabolic cause. Normal CO2 shows no compensation. Strategy, match pH with abnormal, low pH plus low HCO3 equals metabolic acidosis. Question 13, SADA. Causes of hyperkalemia include A. Renal failure. B. ACE inhibitors. C. Corticosteroid therapy. D. Potassium-sparing diuretics. E. Vomiting. Answer, A, B, D. Rationale. Renal failure prevents potassium excretion. ACE inhibitors and potassium-sparing diuretics retain potassium. Vomiting and corticosteroids cause hypokalemia, not hyperkalemia. Strategy, no kidneys, no K plus out. Always think meds plus renal failure. Question 14. ECG change in hypokalemia. A. Peaked T waves. B. U waves. C. Wide QRS. D. Shortened QT. Answer, B. U waves. Rationale, low potassium causes flat or inverted T waves and the appearance of U waves. This reflects delayed ventricular repolarization. Strategy, hypo K equals flat T plus U wave. Hyper K equals tall peaked T. Question 15. Which finding suggests hypermagnesemia? A. Hyperreflexia. B. Tremors. C. Absent reflexes. D. Seizures. Answer, C. Absent reflexes. Rationale, high magnesium depresses neuromuscular activity, leading to decreased or absent reflexes. Severe hypermagnesemia can cause respiratory depression and cardiac arrest. Strategy, low Mg equals twitchy, high Mg equals sluggish. Question 16, case. Patient with diarrhea for 2 days pH 7. 28, HCO3 16. Diagnosis? Answer, metabolic acidosis. Rationale, diarrhea removes bicarbonate, base, lowering HCO3. This creates metabolic acidosis. Strategy, diarrhea equals acidosis, vomiting equals alkalosis. Question 17. Which electrolyte must be replaced slowly to avoid cardiac arrest? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer, C. Potassium. Rationale, potassium given too fast can stop the heart, ventricular fibrillation/asystole. Always dilute and infuse via pump. Never push. Strategy, potassium equals slow plus controlled. Question 18, SATA. Symptoms of hypercalcemia. A. Kidney stones. B. Constipation. C. Polyuria. D. Twitching. E. Bone pain. Answer, A, B, C, E. Question 19. A patient with serum sodium 118 milliequivalent/L and seizures. What is priority? A. Restrict fluids. B. Administer 3% saline. C. Provide oral salt tablets. D. Increase free water intake. Answer, B. Administer 3% saline. Rationale, severe hyponatremia with seizures equals medical emergency. Hypertonic saline restores sodium safely and reduces cerebral edema. Strategy, use hypertonic saline for severe, symptomatic hyponatremia. Question 20. Which condition causes respiratory alkalosis? A. Anxiety attack. B. COPD. C. Pneumonia with CO2 retention. D. Opioid overdose. Answer, A. Anxiety attack. Rationale, hyperventilation during panic removes too much CO2, causing alkalosis. Strategy, alkalosis equals blowing off CO2. Acidosis equals retaining CO2. Question 21. A patient with K plus 2.7 milliequivalent/L should be monitored for A. Muscle twitching. B. Arrhythmias. C. Seizures. D. Hyperreflexia. Answer, B. Arrhythmias. Rationale, potassium regulates cardiac conduction. Low K plus increases risk for life-threatening arrhythmias like PVCs or ventricular tachycardia. Strategy, when K plus is off, think heart first. Question 22, SATA. Signs of fluid overload. A. Crackles in lungs. B. Jugular vein distension. C. Hypotension. D. Edema. E. Weight loss. Answer, A, B, D. Rationale, too much fluid equals congestion. This leads to pulmonary crackles, distended neck veins, and swelling. Hypotension and weight loss are dehydration findings. Strategy, fluid overload equals wet plus swollen. Question 23. Which hormone regulates sodium and water balance? A. Insulin. B. Aldosterone. C. Thyroxine. D. Calcitonin. Answer, B. Aldosterone. Rationale, aldosterone, from adrenal glands, retains sodium and water while excreting potassium. It is part of RAAS, renin-angiotensin-aldosterone system. Strategy, aldosterone equals salt and water saver, potassium loser. Question 24. Which lab confirms dehydration? A. Low urine-specific gravity. B. High hematocrit. C. Low sodium. D. Low BUN. Answer, B. High hematocrit. Rationale, In dehydration, plasma volume drops, making blood more concentrated. Hematocrit rises. Strategy: concentration labs, hematocrit, BUN, specific gravity, in dehydration. Question 25. First intervention for patient with tetany due to hypocalcemia? A. Administer oral calcium. B. Administer 4-calcium gluconate. C. Restrict fluids. D. Encourage mobility. Answer: B. Administer 4-calcium gluconate. Rationale: tetany is severe neuromuscular irritability from low calcium, requiring rapid 4 replacement. Oral calcium is too slow. Strategy: emergencies equals 4 replacement. Question 26. Patient with sodium 152 milliequivalent/L and restlessness. Priority action? A. Give hypertonic saline. B. Restrict fluids. C. Give hypotonic 4 solution. D. Increase sodium intake. Answer: C. Give hypotonic 4 solution. Rationale: hypernatremia equals too much salt, not enough water. Hypotonic fluids, 0.45% NS or D5W, replace free water and lower sodium safely. Strategy: high sodium equals give free water/hypotonic. Question 27, SATA. Symptoms of hypomagnesemia include: A. Tremors. B. Hypertension. C. Muscle cramps. D. Confusion. E. Absent reflexes. Answer: A, B, C, D. Rationale: low magnesium equals neuromuscular excitability, tremors, cramps, HTN, confusion. Absent reflexes equals hypermagnesemia. Strategy: low Mg equals twitchy, high Mg equals floppy. Question 28. Which fluid is used for dehydration with Na 135 milliequivalent/L? A. 0.9% NS. B. 3% NS. C. D5W. D. Lactated ringers. Answer: D. Lactated ringers. Rationale: LR replaces fluids and electrolytes while maintaining normal sodium levels. 0.9% NS is also possible, but LR is balanced for dehydration. Strategy: isotonic fluids equals first choice for dehydration. Question 29. Which electrolyte is critical for neuromuscular excitability and blood clotting? A. Potassium. B. Calcium. C. Sodium. D. Magnesium. Answer: B. Calcium. Rationale: calcium stabilizes nerve and muscle activity and helps with clotting. Strategy: calcium equals clotting plus contraction. Question 30. Patient with K plus 6.9 milliequivalent/L, peaked T waves, and dyspnea. Priority intervention? A. Give oral potassium. B. Give calcium gluconate 4. C. Encourage bananas. D. Start potassium infusion. Answer: B. Give calcium gluconate 4. Rationale: calcium gluconate protects the heart temporarily while other treatments lower potassium. This is life-saving. Strategy: severe hyperkalemia equals protect heart first, then lower K+. Question 31, SATA. Causes of metabolic alkalosis. A. Prolonged vomiting. B. Diuretic use. C. Antacid overuse. D. Diarrhea. E. NG suction. Answer: A, B, C, E. Rationale: vomiting and NG suction remove acid. Diuretics and antacids also cause alkalosis. Diarrhea causes acidosis. Strategy: loss of acid equals alkalosis. Question 32. Patient with hyponatremia on 4 fluids develops confusion and crackles. What is happening? A. Overhydration. B. Dehydration. C. Hypokalemia. D. Hypercalcemia. Answer: A. Overhydration. Rationale: hyponatremia plus fluid overload equals brain swelling plus pulmonary edema. Strategy: confusion plus crackles equals fluid overload. Question 33. Which electrolyte regulates nerve and muscle contraction most closely with sodium? A. Magnesium. B. Potassium. C. Calcium. D. Chloride. Answer: D. Chloride. Rationale: sodium and chloride move together. Chloride balances sodium in extracellular fluid. Strategy: think NaCl. Question 34. A patient with COPD has pH 7.28, PaCO2 60, HCO 326. Interpretation: A. Metabolic acidosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Answer: B. Respiratory acidosis. Rationale: pH low equals acidosis, PaCO2 high equals respiratory cause. Strategy: high CO2 equals acidosis, low CO2 equals alkalosis. Question 35, SATA. Treatment of hyperkalemia includes: A. Ecellate. B. For insulin with glucose. C. Calcium gluconate. D. Sodium bicarbonate. E. Potassium chloride. Answer: A, B, C, D. Rationale: Ecellate removes K+, insulin plus glucose shifts K+ into cells, calcium protects heart, and bicarbonate helps shift K+. Giving potassium worsens hyperkalemia. Strategy: shift it, bind it, stabilize heart. Question 36. A patient on loop diuretics develops leg cramps. Which electrolyte is likely low? A. Potassium. B. Calcium. C. Sodium. D. Magnesium. Answer: A. Potassium. Rationale: loop diuretics, furosemide, cause major K+ loss cramps and arrhythmias. Strategy: loop equals lose potassium. Question 37. Which electrolyte imbalance is linked with Chvostek's and Trousseau's signs? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypermagnesemia. Answer: B. Hypocalcemia. Rationale: both signs indicate neuromuscular excitability due to low calcium. Strategy: low calcium equals twitchy. Question 38. Which fluid should be avoided in increased intracranial pressure, ICP? A. 0.9% NS. B. 3% NS. C. D5W. D. LR. Answer: C. D5W. Rationale: D5W becomes hypotonic in the body, worsening cerebral edema in ICP. Strategy: avoid hypotonic fluids and brain swelling. Question 39, SATA. Signs of dehydration. A. Dry mucous membranes. B. Sunken eyes. C. Increased BP. D. Poor skin turgor. E. Weight loss. Answer: A, B, D, E. Rationale: dehydration equals volume loss, dry tissues, weight loss, poor skin elasticity. BP usually decreases, not increases. Strategy: think dry and skinny. Question 40. Which electrolyte imbalance prolongs QD interval and increases risk of torsades de pointes? A. Hypercalcemia. B. Hypokalemia. C. Hypomagnesemia. D. Hypernatremia. Answer: C. Hypomagnesemia. Rationale: low magnesium equals prolonged QD and life-threatening torsades. Strategy: Mg equals heart rhythm stabilizer. Question 41. Patient with Na 130 and fluid restriction asks for fluids. Best nurse response? A. You can drink as much as you want. B. Fluids will make your sodium lower. C. I'll bring extra fluids now. D. Drink coffee instead. Answer: B. Fluids will make your sodium lower. Rationale: education should be honest and simple. Excess fluid worsens hyponatremia. Strategy: explain why, not just what. Question 42. Which electrolyte is most closely tied to insulin function? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer, C. Potassium. Rationale, insulin drives potassium into cells. Lack of insulin hyperkalemia. Strategy, insulin equals K plus shift. Question 43, SATA. Nursing actions for hypernatremia. A. Restrict sodium. B. Give free water. C. Administer hypotonic fluids. D. Monitor neurostatus. E. Encourage salty foods. Answer, A, B, C, D. Rationale, treatment equals lower sodium and hydrate safely. Avoid extra salt. Strategy, think dilute and monitor brain. Question 44. Which electrolyte imbalance is most dangerous for the heart? A. Hyperkalemia. B. Hypocalcemia. C. Hyponatremia. D. Hypomagnesemia. Answer, A. Hyperkalemia. Rationale, severe hyperkalemia causes fatal arrhythmias. Strategy, always check K plus first in cardiac patients. Question 45. Patient with metabolic acidosis from renal failure will likely have which electrolyte abnormality? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Answer, B. Hyperkalemia. Rationale, kidneys fail to excrete K+, causing acidosis and hyperkalemia. Strategy, renal failure equals high K+. Question 46, SATA. Causes of hypokalemia. A. Vomiting. B. NG suction. C. Diuretics. D. Addison's disease. E. Insulin therapy. Answer, A, B, C, E. Rationale, vomiting, NG suction, diuretics, and insulin lower K+. Addison's, low aldosterone, causes hyperkalemia. Strategy, GI loss plus meds plus insulin equals low K+. Question 47. Which lab confirms hypervolemia? A. Low urine-specific gravity. B. High BUN. C. Low hematocrit. D. High sodium. Answer, C. Low hematocrit. Rationale, excess fluid dilutes blood, lowering hematocrit. Strategy, fluid overload equals dilution labs. Question 48. Which electrolyte imbalance is most common with alcohol withdrawal? A. Hypokalemia. B. Hypomagnesemia. C. Hypercalcemia. D. Hypernatremia. Answer, B. Hypomagnesemia. Rationale, alcohol abuse depletes magnesium, causing tremors and seizures. Strategy, think low Mg in alcoholics. Question 49. Which electrolyte imbalance causes tendency, laryngospasm, and seizures? A. Hypocalcemia. B. Hypercalcemia. C. Hypernatremia. D. Hypermagnesemia. Answer, A. Hypocalcemia. Rationale, low calcium equals neuromuscular irritability. Strategy, twitchy equals low calcium. Question 50. Nurse caring for patient with potassium infusion via 4 pump. What action is correct? A. Give 4 push for quick effect. B. Always dilute and infuse slowly. C. Give with dextrose only. D. Stop if patient reports burning. Answer, B. Always dilute and infuse slowly. Rationale, potassium must never be 4 push, dilute and give slowly to prevent cardiac arrest. Strategy, K plus equals no push, slow drip only. You did it. Party popper, you've just mastered 50 of the most high-yield fluid and electrolyte questions that Nclex loves to ask. Remember, it's not about memorizing, it's about understanding the patterns and strategies. If you found this helpful, hit that like button, subscribe, and share this with a study buddy who's also grinding for Nclex. Lightbulb, and don't forget to check out my other Nclex videos for even more practice questions. Until next time, keep pushing forward, your RN license is closer than you think.